Greg Soderlund, the race director for the Western States 100. I'm here today to talk to you about our major medical checkpoints. Each checkpoint is equipped with 2 medical boxes, a major medical box and our podiatry box. We have 10 major medical checkpoints along the course. Each is captained by an MD or an RN. Each has a staff of medical professionals, EMTs, paramedics, RNs, and physicians. At this time, I'd like to go over the inventory for the podiatry kit and the major medical kit. Here on the table, you see the contents of each podiatry kit. There's 10 of these along the course. Each podiatry kit contains tincture of benzoin. We use that to make things stick to the foot. We've got some cloth tape or Zonus tape used for spraining ankles. Ace bandages, 2 and 3 inch. Moleskin and an adhesive knit. They both serve the same function to cover blisters. Hypodermic needles to perforate the edges of a blister and let the blister drain. And if the needle isn't enough, we've got 11 blades in each podiatry kit. Providine ointment. Band-Aid, blister block or Compeed, and second skin. A variety of cotton balls, 4x4s and 2x2s. Hydrogen peroxide, baby powder, alcohol, the all-important duct tape, Vaseline, a shoehorn, that's important to get the shoe back on after you treated the blisters, scissors, and a variety of gloves. You should be gloved with each runner that you treat for a blister. I'd like to take this time to do a demonstration of a blister treatment. This is, for many, a great mystery, but actually it's very simple to treat blisters, and perhaps a runner will have you to thank for their finish by just taking a few minutes to properly treat a blister. Each major medical kit has 2 bags in it. One bag is for IVs, the heavy one, and a dressing bag. And I'll show you the contents of each now. Each IV bag contains 12 IV starter kits, 12 IV lines, 12 IV catheters, 1 bag of hypertonic saline 3%, 6 bags of normal sodium 0.9%, and 1 bag of 5% dextrose. Notice how I said 12 IVs and 6 bags of normal saline. We give you 2 for every bag, so if it takes 2 shots to get into the vein, you still have another IV setup to use. A lot of these runners are going to be hypotensive, so it's a little hard sometimes to get an IV the first time. So probably the best thing is to have them supine laying down, and then they're going to have a little more blood volume in their arms, so it'll be a little easier to hit the vein. So that's in the IV kit. Okay, we'll look at the contents of the major medical kits. Each kit has a sharps container that contains a variety of syringes, tuberculin syringes. Each kit has aspirin, 2 aspirin, and 2 nitroglycerin for chest pain. We've actually used that, by the way. adrenaline and Benadryl for insect bites, a ear thermometer, double antibiotic ointment, scissors, 5 cc syringes, betadine and alcohol wipes, paper tape and cloth tape, 4x4s and 2x2s, Band-Aids, insect repellent. We have some aid stations that have a high density of mosquitoes. Not all the aid stations get the insect repellent, but the ones that have pests like mosquitoes do. Cotton tip applicators, a variety of ace bandages, and Coban, Curlix, a lot of dust on the trail. So we have eye irrigation, a variety of different eye irrigations, over-the-counter eye irrigations. We do not stock Motrin in the aid stations, only Tylenol, Providine paint, hydrogen peroxide, alcohol, and a variety of gloves.